welcome to Joy in Our Town. We are so glad that you joined us today. I'm Terry Crider, and I'll be your host today. And we have some real important family issues to talk about today. And so I want you to pay very close attention, because it is things that may not affect your family, but it may affect a family close to you, or it will definitely affect families in your neighborhood. And these are issues that affect the family, but they're also urgent for advocacy. We need you to call senators and congressmen and push that these programs are not cut, because they're so important. Let me introduce to you my guest, Jason Bearden. He's from Highland Rivers Behavioral Health in Dalton. And you're not just in Dalton, you're in
the greater Northwest Georgia.
Greater Northwest Georgia.
So it really covers a 12-county region that begins on the northern end in Dalton in Whitfield County. If you follow I-75 down and dogleg out to Floyd County, down the Alabama line to Harrelson, and jog back up through Polk, Bartow, Cherokee counties, and then follow I-575 when it turns into I-515 up Cherokee, Pickens, Gilmer, Fannin, and then jog back over to the left across the North Carolina and Tennessee border across Fannin, Murray, and back to Whitfield. It's that triangle in northwest part of the state. The only 4 counties in northwest Georgia that we really don't cover to a large degree. We do in part some, but the 4 northwest counties in Dade, Catoosa, Walker, and Chattooga.
Okay. I'm going to start off. There's 2 programs that you all handle that I want to really focus on today. One of them is developmental disability, and the other one is Women Ready for Work. And I want to start with the developmental disability program that you have. Would you explain that to the people?
Sure. So developmental disabilities are individuals with intellectual disabilities, and historically people may have referred to these individuals in our society as the mentally retarded population. Bleeds into some of the autistic population, and these are folks that are really the most in need, the indigent population in society that really government, public servants are called to take care of. And that's from a behavioral health provider in Highland Rivers. That's what we're here to do. We are a public nonprofit that provides ongoing services to these individuals in many forms to keep these individuals in the most independent setting in their homes with their families, or if the families want to have the individual live independent of the family but in the same community, help the family achieve that with their loved one, with their child, with their brother, with their sister, or with their extended family. And that's what we're here in the community to do.
Explain to me, like, all right, say I want to keep, let's say it's my son, and he's, you know, my oldest son is 41. So let's say my son has a mental retardation, and I want to keep him at home with me. But physically, it would pose some problems. I mean, you know, as men grow, they get big. Right. And being a mama, it's not like taking care of a baby anymore. So how could you help me in that situation?
And so, great question. With these individuals, they are, in many cases, very childlike because of the developmental disability issues. In many cases, many have an aptitude of a 1, 2, 3, 4-year-old in an adult body. So as you mentioned, this is a challenge to folks that still need to maintain a quality of life within the community, go out and provide for their families through work. Many of these individuals without services would not be able to do that because they would have to care for their child, their loved one, on a 24/7 basis. So what we do is we provide services in-home to these individuals, to these families, where we have caseworkers, case managers that come in and provide personal support services, activity of daily living type of needs.
Gotcha.
Many times these people are not capable and have the capacity to meet the daily needs, from bathing, from feeding themselves, from bathroom, toiletry type of issues.
Right.
And we are there to facilitate that, help in those areas, and hopefully maintain as high of a level of independence for their loved one as possible. Teach them and teach them skills and teach them capacity to be able to be able to independently care for themselves without our service. But in many cases, these folks will always need some type of service in the home in order to allow you and others with children with these disabilities the ability to have some type of quality of life and provide for their families.
Well,
so there's an economic impact and a quality of life impact.
And this program is currently under a financial challenge, am I correct?
You're correct, absolutely.
Now, explain that to me and explain how we can help.
So currently, right now, the state of Georgia legislative session started January 9th, and it runs 40 calendar days. That means those 40 days are stretched out over a period of 3 months.
Okay.
So the session generally runs the 1st of January through the end of April. And right now, the state of Georgia is looking at reducing rates to providers for providers that serve these individuals. And the rate cuts, as they've been studied, can range anywhere from 20% to 35%. Wow. And what that means to the individual that's being served, to the family unit out there in the community, is there could be access limitations. As rates are cut, there will be smaller providers. Not Highland Rivers. We're going to be around.
Yay.
We will be in place, thank God.
It. Yeah, yeah.
But we have concerns for the larger community of Northwest Georgia and Northern Georgia. Smaller mom and pop providers may not be around, may not be able to sustain because they don't have the economies of scale of a Highland Rivers. They are specifically a developmental disability provider. And with
Y'all
that,
got tons of programs, yes.
We do, and a wide range of programs.
So how can I be an advocate?
So in terms of being an advocate, we have really a 2-month window between now, today, and the end of February to call our legislators, to call your local legislators, let them know that the community at large is very concerned about the rate cuts being proposed by the Department of Behavioral Health and Developmental Disabilities at the state level, and we need the legislators to take leadership, and the governor, and to call the governor as well, the governor's office, take leadership and advocacy to let them know the impact this could have on our community at large. And again, it will impact the family unit, but it will also impact the community at large from an economic perspective if services are not in place in the community as they are today, because providers will go out of business, access will be limited.
Wow. All right, then there's another program called Women Ready for Work, and I'm going to let you explain that because it's very close to my heart, so go for it.
Right, so another big part of what we do as a behavioral health provider, addictive disease, as we all know, is a huge epidemic across the country, but I think it is more intensified here in North Georgia with meth and the meth epidemic that we've been dealing with over the last 10 years. And the Women's Ready for Work program is a long-term residential substance abuse program located in both Dalton and Rome, Georgia.
Okay.
And it is a phenomenal program with great outcomes. And some of the outcomes that the women that go into our program come out with, number one, they come in homeless, and they come in oftentimes without a job, homeless and not working. When they come out of our program, and our program is a 4 to 6 month program, long-term residential in both.
Which is super, yeah.
Yes, absolutely. In both Rome and Dalton, 80% of them come out with a job, and 80% come out with some type of shelter or housing that they did not have before coming into the program.
Right. And the thing that makes your program so different is there's lots of substance abuse places. There's lots of places that you can send your family for substance abuse. But the difference in your program is that you do not separate them from their children.
Absolutely.
You keep them with their children. Explain how that goes.
So most substance abuse programs, mom, if she needs treatment, mom goes into the treatment facility and the child is separated from mom and sometimes put into foster care with extended family, and that's not healthy for mom or child. So what our program does is it enables mom and child to stay together through the length of the treatment process, and the mom has the assurance that her child is going to be well taken care of, because incorporated into the overall program is a daycare during the day while mom is receiving treatment by our staff and our individuals, and that is a big differentiation. Another big differentiation in our program, because we are the public safety net program in Georgia, our actually official code in the state Georgia code is classified as a community service board, which means we are the last stop shop for the indigent, low-income population. There are many of us in the general population that have the means to pay for private substance abuse residential programs. This is a publicly funded program that anyone with no means can get at no cost. It's publicly funded and subsidized. So it is not only a very accessible program, but it is a program that saves quite a bit of money for the state and the local communities at the local government level and the state government level. It does really two primary things in terms of diversion from a financial civic perspective. Number one, if mom comes into the program, 60 to 70% of those women would have ended up in jail or prison. So this program successfully diverts mom out of prison or jail, which of course saves significant money at the local county level and the state level. We know it costs about $50, $55 a day to serve someone in an incarcerated environment. The second benefit is it keeps mom, as we talked about, mom and child together. So the child is diverted out of the DFACS foster care end. And we know that costs anywhere from $15 to as much as $100 a day, depending on the complexity of the child. Our program, from a residential component and substance abuse program component, is $15 a day, the residential component, and $10 a day for the substance abuse treatment component.
That's a big difference.
It is.
Big difference.
So I'm a numbers guy, and the cost benefit is pretty clear.
Well, and we should be numbers people also. You know, I minister in prisons quite a bit, and the majority of the ladies that we minister to are there because of substance abuse, and they've been separated from their children, and they'll sit and cry and cry and cry because they don't have their babies, and this could be totally averted. Now, again, we've got just 1 minute. Tell me where this program stands in the legislative part and how we can help.
So funding is set to be cut by July by 50%. If money is not found at 50%, so we're talking about a $1.25 million cut. So the 250 women we serve will go to 125, and the kids will go from 450 to 225. If funding is not found at the state level or federal level in Congress by July 1, that will in fact happen. So Congress is in the middle of a big budget debate, as we all know. I think there's advocacy efforts to be done with our local congressmen up in Washington. But more importantly, a little easier touch and impact that we have is at the state level. The state has resources, and there's a big move around accountability courts and diversionary services to keep people out of prisons. You cannot, if you can have all the accountability courts you want to divert people, but without a treatment provider, the court does no good. So our advocacy is keep the treatment you know that works, and our outcomes are well documented. Fund that, keep that in place instead of tearing it down and reinventing the wheel a couple of years down the road and wasting taxpayer money. Now,
when they call their congressmen or senators, whether state or federal, do they need to mention your program by name?
They can mention the TANF, T-A-N-F.
T-A-N-F.
Women's Ready for Work program. And it is statewide, 20 programs across the state. Highland Rivers is one of the bigger programs here in Rome and Floyd.
Tell the people how they can get in touch with you if they need your help.
You can get in touch with me through the website www.highlandrivers.org. On that website, there is contact information to reach our administrative offices.
All right.